So the inferior cervical intervertebral joints are just like the typical intervertebral joints elsewhere found in the vertebral column. And these are formed between the C2, second cervical vertebra, that is the axis, and below to it is the third cervical vertebra, then from C3 to C6, and then between the C6 to C7. That is the sixth cervical vertebra and seventh cervical vertebra. So all of these joints, they fall in the category of inferior typical cervical intervertebral joints. They are further of two types. They belong to two categories: anterior intervertebral joints and posterior intervertebral joints. The anterior intervertebral joint articulation is between the inferior surface of body of above lying vertebra and superior surface of the body of the below lying vertebra. Their articular surfaces are covered by hyaline cartilage, but the joint between the joint there is a bar of fibrocartilage that is called the intervertebral disc. This is why this particular type of joint belongs to the secondary cartilaginous variety of the joints. Then we come to the posterior intervertebral joints. The posterior intervertebral joints are formed between the inferior articular facets of the above lying vertebra with the superior articular facets of the below lying or inferior lying vertebra. And these joints, they belong to the synovial variety. They have a cavity in between them. And because of the presence of that cavity, these joints have their own fibrous capsule. The posterior intervertebral joints have their own fibrous capsule. Secondly, this was all about the articulation and articulation and capsule of these intervertebral joints. What about ligaments? The anterior intervertebral joints are strengthened by the presence of two longitudinal ligaments. One of them, which is the anterior lying, is called the anterior longitudinal ligament, and the one that covers the posterior aspect of the bodies of the adjacent vertebrae is called posterior longitudinal ligament. And the ligament responsible for the strength, providing the strength to the posterior intervertebral joint in addition to their fibrous capsule is ligamentum flavum, which gets attached over the anterior and inferior aspects of the laminae of respective adjacent vertebrae. So since the symphysial joints, they are secondary cartilaginous, so only restricted movements are possible at these joints. But over the posterior intervertebral joints, anterior flexion and extension is still possible, and also lateral flexion is possible at the posterior intervertebral joints.